Okay, gentlemen, you can begin. Hi, Mr. Boy.
Yep.
Yeah, you could begin. We're live.
Good evening, everyone. Welcome to Globespan's 24x7 show. And I'd like to thank Mr. Noah Singh for asking us to moderate tonight. The discussions that we're going to be having center around the coronavirus, also known as COVID-19. And we've got a great panel of speakers tonight from Guyana as well as in the diaspora to give Guyanese a sense of what is going on with this virus, both at home and with our friends and loved ones in New York. And so, with that, I'd ask the panelists to go ahead and introduce themselves. So, we can start with Dr. Frank Anthony.
Hi, Dr. Anthony. You seem to be muted. Can you click the mic icon?
Yeah. I'm Frank Anthony. I'm a former Minister of Culture, Youth and Sport, and I've been doing quite a lot of public health recently. I spent about 14 years in the public sector in the Ministry of Health, and now I'm back in private practice.
Hi, I'm Dr. Mahendra Karpan. I'm an interventional cardiologist. I'm attached to several private hospitals in Georgetown, but my main portfolio is as head of medical services at the Georgetown Public Hospital and a consultant cardiologist.
We have two Richards with us tonight. So I'll ask Richard D.
Good night, everyone. I'm Richard David. I live in Queens, New York, and I'm the Democratic District Leader in Assembly District 31, which includes Richmond Hill and South Ozone Park.
And Richard Torres.
Good evening, everyone. Richard Rambaran. I am currently the Executive Director of the Chamber of Commerce here in Guyana. I am a lecturer of economics and economic development in the Department of Economics at University of Guyana, and I do consultancy for both public and private sector. Thank you.
Thank you. Thank you all for being here tonight. And so, why don't we start with the two doctors and to give a brief, kind of quick introduction about the virus. So I'll put this one quickly to Dr. Anthony. What is COVID-19? Because I know a lot of people have heard about it, and I'm sure many of Globespan's, let's say, viewership has already done their research, if not experienced it firsthand in New York right now.
Well, COVID-19 is a disease that is caused by the SARS coronavirus 2. And it first started in Wuhan in China and has since been spreading around the world. We have been seeing a lot of different signs and symptoms of it. And one of the things that is very common with people who get infected is that they will have fever, a dry cough, and in some cases, they will also have shortness of breath. These are the kind of main signs and symptoms that people would experience. And so this has been spreading around the world. And as we know, it is causing a lot of problems to people around the world. I'm sure Dr. Karpan would like to add something.
Yeah, well, it's something, as Frank said, it's around the world. It's a pandemic. It's a virus that started one place, and the world, as you know, is a much smaller place than it was 50 years ago. So through travel and other human contact, it has been able to spread all the way to our own homeland here. And in many places, it's actually creating havoc, crashing healthcare systems, causing lots of deaths, causing lots of disabilities, and in fact, it has thrown the whole world into some kind of turmoil. Trade, commerce, healthcare, everything is affected. Every aspect of our existence in society has been touched by this disease, because it's not something you can see, and you don't oftentimes know who are the persons who are affected that you can, contract this disease from. So it kind of leaves you almost feeling a state of helplessness, and it comes with a lot of physical health concerns as well as mental health concerns, both for patients and health practitioners.
Thank you. Thank you for that introduction. So the key thing about tonight's discussion is that obviously in Guyana right now, we have around 33 cases this afternoon. We have 5 deaths. Now, we have a population of 750,000 people, and a lot of people are saying, well, why is it such a big concern right now? So, Richard D., what is going on in New York? Tell us a little bit about the situation in New York as it relates to the coronavirus.
Yeah, thank you for having this important discussion. And we have widespread community transmission. That's what it's called, where we've lost control of the virus getting from one person to another person. We've lost control of it in New York. And as of this afternoon at 5 o'clock, we have over 74,000 people in New York City who are tested positive. 74,000 people. That's as of 5 p.m. this afternoon. At 9 a.m. this morning, that number was about 1,000 less. So just today alone, we have, and we believe that we're beginning to get control of this with increased testing, but we are completely in shutdown in New York. Only essential workers are able to work right now. Essential workers are people who are in hospitals, who provide food and other kinds of medical supplies and transportation. Otherwise, we're being told to stay at home, and if we go out, we have to maintain a 6-foot distance between us and the next person. We've lost control of the virus in New York, and it's devastating people, and it's devastating families and communities.
Wow, that is interesting, because if I remember well, on what I'm looking at on CNN, it's saying that New York is providing almost a quarter, if not more, of the cases in the U.S., and a similar figure in terms of the number of deaths.
Today we had about 30. In total, we have about 3,200 people who have died, and New York City is the epicenter of the virus in the United States. I believe now we have more cases than any other country in the world. And Queens, where the Guyanese community lives, has more cases than any other borough. We also have the highest number of fatalities.
Wow. And so the other thing I would ask is, how long has it been since, let's say, the first days of the outbreak in New York City?
It's hard to tell when we had the first. I don't know when we had the first case.
Yeah, not like the first case, but general.
Yeah, a couple of hundred cases came in early in March. We weren't testing, and we weren't prepared to test. When we ramped up our ability to test overnight, thousands of cases were all over. It was widespread, and we just didn't have an ability to not just treat people in hospitals, to just test them. And that's why we had to shut down the city. New York City has never shut down, not even in world wars. We've never seen something like this in 9/11. In Hurricane Sandy, which flooded the city, we've never seen something like this, both in terms of the scale, the strain it's putting on government and hospitals. We've never seen something like this in terms of the toll on human lives, and we've never seen such devastating economic impact.
Well, definitely. And so one thing I should correct is that I didn't introduce myself for the audience. My name is Nicholas Boyer. I'm the president of the Georgetown Chamber of Commerce and Industry. You're going to have to bear with me. This is my first time sitting in the seat of a moderator. But coming back to the discussions, why I have this interesting smile on my face, and I put this to Dr. Anthony and to Dr. Carpel, is that, does this situation sound familiar right now? Does what
Richard D just described sound very familiar to you? And what are your thoughts on terms of what he just said and for us in Guyana?
Well, I think you gave the statistics earlier that we have so far 33 persons who have tested positive, and we have already seen 5 deaths. Now, the reason why those numbers look so small, it is because we are not testing a lot of people. In fact, it was reported today that we only tested so far 132 or 133 persons, and therefore we really don't know what's the magnitude of the epidemic. So there's probably a lot more people who are positive, but because we are not offering the tests to persons with the signs and symptoms, and even asymptomatic people, that we are not sure what is going on with the epidemic. And what compounds this problem is that we have one laboratory in Guyana that is doing the testing, and that's the National Public Health Reference Laboratory that's run by the government, and only that laboratory is allowed to do the testing. Unlike what has happened in the United States, the United States now is allowing the private sector to be very active in manufacturing various types of tests and rolling them out so that they can ramp up the testing in the US. We have not allowed the private laboratories and the private hospital to offer this test. So that is really constraining our capacity to test and understand the magnitude of the epidemic that we have on hand.
Yeah, so let me join in there. If you don't test, you don't know your numbers. But I understand we have resource challenges with being able to test everyone who really should be tested. Even the US has that challenge, Canada has that challenge, developed world has that challenge. The countries that have been able to do it well are places like South Korea, Singapore, Malaysia, Japan. But right in our own backyard, we have a very good example that we can look towards. Jamaica has been doing a lot of testing, and their public health policy towards this epidemic has shown remarkable results in, achieving this concept that we call flattening the curve. The curve for disease prevalences from an epidemiological point of view is a basic bell-shaped curve. And what you try to do, the problem with that is that you can handle 20,000 patients at Georgetown Hospital, for example, if they're stretched out over a year. But you can't handle 20,000 patients in 3 weeks and 4 weeks. So if you try to flatten the curve by reducing the number of actively infected sick patients by following the preventive measures, then you allow your healthcare system to actually cope with the problem. And the only way you actually get a handle of who are the people to be isolated and quarantined, etc., is if you have testing of contacts and potentially infected patients. Now, as of today, the Trinidad and Tobago Health Services have allowed their private laboratories to do testing. We don't need to wait until we get overwhelmed in the public sector to allow private labs to be able to do it. I think it's reasonable for the quality and standards to be policed by the authorities, but in order to achieve widespread capacity, we have to engage the private sector, private hospitals, private labs, those that are certified to be able to do this and make it reportable. So if they do a case, if they do a test and it's negative, it's reported. If it's positive, it's reported. So you're able to capture your data. But in the absence of that, we have to shift the paradigm of how we think about this infection. We're probably never going to be able to test everyone that needs to be tested. So we have to stop looking at that as the indicator, but rather the amount of sick patients who are turning up to hospital, which is a much more easier metric to follow. And that's how we can know when the curve is peaking, when it's on the decline, when it's on the upstroke, etc.
Thanks for that. And Richard,
One
go ahead.
one of the challenge though is that for us to do what Dr. Carpen is suggesting, is that the ministry needs to change its definition of what is a case, because apart from using the epidemiological definition, they're also saying you need a laboratory conformed test before you become a case. And so in like many other countries, what has happened is that countries have evolved their definition as the epidemic unfolds, and therefore there's nothing wrong with us changing our definition as we are now seeing increased cases and if we have restricted capacity.
Got it. Well, let me ask a question now, Richard. Let's focus on that curve part, Richard Ramran. You ran a model for us at the Georgetown Chamber of Commerce and Industry, and your model had said how many people do you expect to be infected by the end of May if we do not practice social distancing?
Thank you for that, Nick. Good night, everyone. Again, good night, viewers. So it struck me a little bit off when the Pan American Health Organization, PAHO, said initially 1,400 cases. And looking at what the trend of it is, looking at the reproduction rate of the virus, the incubation period, etc. And essentially how the virus spreads. When you look at its structure and you try to model what's happening, you'd find that anyone who is trained in statistics or econometrics or other types of mathematical modeling would be able to fashion what's happening. So I took it upon myself to model what I project into the future based on the reproduction rate on the virus as well as the incubation rate. So this is before the Pan American Health Organization, PAHO, had revised their numbers. I found that at the end of the first week in May, my model was telling me that we would have been roughly, or we would be somewhere around 19,500 or 600 cases. And this is looking at the rate of reproduction of the virus as reported officially by the Ministry of Public Health. So I have my own thoughts on the numbers, and I do have a particular technique which I'm using to ascertain what the local, what I believe the local spread is and how much of the virus is in the country or in the society. But working with the Ministry of Public Health's numbers, I came up with roughly about 19,500 by the end of the first week in May. I subsequently saw about a day or two later that the Pan American Health Organization came out with this position that it's expecting about 20 by the end by May 5th. Now, for those here who are public health specialists and who are medical doctors, I mean, this is an unprecedented and a very worrying situation within the context of Guyana. And two particular reasons come up in my mind when assessing what's happening. The first is that the public health infrastructure in Guyana is so badly underdeveloped as opposed to perhaps even the wider Anglophonic Caribbean that the number of cases which the model predicts will simply not be able to be absorbed into the public health infrastructure, the healthcare system which we have here, the number of health personnel, etc., which we have. Now that compounded with our underlying proclivity in the society for the high prevalence of chronic non-communicable diseases. From my perspective, looking on and working some analysis from a health economic perspective makes it a very worrying thing. So, Nick, essentially my model, which I work, the numbers so far are going in accordance with what is being reported, which if we take what is being reported as being the official statistics and run with that, within about a week or two, Guyana is looking at a very, very worrying situation. And this is without any particular changes or drastic changes to the lifestyle and to the way that we socialize and interact with each other.
So essentially, your model says that the next 2 weeks, especially in the policy making sphere for us, are very critical.
Absolutely. Absolutely. Now, when modeling, I give myself roughly about a 10% margin of error. So whatever number I come up with, it's usually, I give myself about 10% more or 10% less, a 90% confidence interval, we call it in statistics. So within about 2 weeks, if we are not careful and if it continues to spread, you are looking at anywhere between 225 to roughly 270 cases. And that in itself is worrying because we can see what is happening here with just a couple dozen cases.
So just to add something on that, right? What we are going to see in the next 2 weeks is actually the result of what happens this week or last week. So we're still behind the curve, or the active curve for that. So if we want to influence, if we want to make changes now to influence something, if we do it now, it will influence the end of April or early May. It would, I think it will have a difficult time to influence next week and the following week, because the incubation period of the disease is, 2 to 11, 14 days. It depends.
Yeah.
But and that is why, so the funny part is why I spoke with Noah about doing this program, because I told him that we needed to get the word out there because of how dire the situation is and how lightly I think we in Guyana were taking the situation, and it's something that is really concerning to me. And for instance, we've seen that last Friday the government has implemented or put in, let's say, the legal framework for a lockdown. It's a popular term seen across all the news media and outlets being put in. But then you saw the Prime Minister's interview on Saturday, and the Prime Minister is the head of the National Task Force, and it seemed to be more of a curfew than a lockdown. I would love to get the panel's opinion on what they thought of the lockdown, whether it was too strict, whether it was strict enough, not strict enough, and whether we should be taking additional steps to increase the strictness of the lockdown.
Well, maybe if we can just go back a little bit, and that is, if we want to change this curve that we're talking about, and Richard spoke about it with the model that he did, and then subsequent to that, PAHO then revised or maybe came out with another simulation, and that simulation is telling us that by May, we'll have about 20,000 cases, or 20,857 to be exact. Now, if that is allowed to go on, what that would mean is that they're categorizing patients in three categories: mild, severe, and critical. And for those who are critical, they would need ICU beds. And they're predicting, if this model is to hold, that you would end up with something like 202 ICU beds that you would need. We don't have that amount of beds. And at Georgetown Hospital, perhaps Dr. Carpen would be more informed than I am. But I think the isolation beds that they have for COVID patients is probably about 14. And maybe if you look at the ICU unit, you probably have another 8 or so. So we don't have a lot of beds. And when you're talking about critical patients, they would need to have access maybe to ventilators. And again, that is something that we are very constrained with in Guyana. We don't have enough ventilators. So we don't want people to get to that stage where they would we'll have so many persons who would be critically ill or severely ill. Because again, if you have persons, this model is predicting that with severely ill, with persons who would require hospitalization, that's another 566 persons. Now, we don't want all these persons to be in the hospital. And the only way that we can prevent that is really trying to slow this epidemic. And how do we slow it? It means that we have to be out of contact with other people, right? What we are seeing is people walking around like if it's a normal day. Up to recently, people were still going in the shops and the rum shops and everything else and having a good time. And I'm still seeing images of people going to markets and they're just carrying on as if it's a normal thing. Now, the big challenge that we have is that there are a lot of people who might be asymptomatic or have mild symptoms, and they're carrying this disease. And they would come in contact with other people who were not infected as yet, but because we are not maintaining what is called social distancing, those persons who are uninfected would become infected. So the only way that we can prevent this is really we need to maintain that social distance, which really is not happening in Guyana, right? It's not happening. And I don't think this curfew is really helping. I mean, it might stop people from going to bars and restaurants, which is great. But what happened during the day? You're not advising people what to do. People are using public transport and going about their business as usual. And so they're coming in contact, close proximity with other persons who might be likely to carry the disease. And that's a worrying trend, because if we don't take the precautions, we will end up with sick people going to the hospital and we'll overwhelm the hospital system.
Definitely. And the thing is, how many, let's say, emergency or ICU beds are available right now? Because in our discussions with the authorities, they said that they had about 350 beds in the Georgetown area for isolation and another 150 around the region. I should specify, not ICU. These were isolation beds. And for us, when we work backwards, because initially when we met with the authorities, what they said was that for the first part of last week, they were going to be planning for 1,400 cases. And Richard had done this model since last weekend. So when we saw them say that, it kind of blew our minds, because the mathematics are for these types of viruses are very simple. And then we watched them say, okay, 1,400 cases, and then to the end of the week, they say 20,000 cases, and they were under resourced at 1,400, much less at 20,000. What have they said to yourselves as doctors? And Dr. Carpenter, you could probably take this one because you're in the public health system. What have they said to you is the number of resources they have on hand currently?
Not a lot. Not a lot of communication specific to that question. But I want to just comment on the number of beds and as it relates to the coming epidemic. The problem is that you may have 100 beds or 100 ICU beds, but these patients are coming and they're not going to come in for one day and get discharged the next day. They're going to occupy beds for a week and 2 weeks. And while they're on that bed, there's new disease patients coming in. And this is just COVID. What about the heart attack patients, the stroke patients, the accident patient, the cancer patient? What about all of those other patients? So we are, like many other places in the world, severely under-resourced when it comes to bed spaces, human resource, and medical resources. And the only way that we can fight this is to reduce the number of patients coming in at a time. And that's that concept of flattening the curve. You spread out your cases over a longer period, so it gives your system a chance to fight.
So, given all of this, go ahead.
Yeah. even if you look at the bed capacity, right? I think Georgetown Hospital, you have what, overall about 600 beds, you know. So even if we convert the whole of Georgetown Hospital to deal with COVID patient with a surge, we just can't make it, right? Because if we're talking about a surge of 20,000 people, we can't deal with 20,000 people. And that's something that I think the general public needs to understand. And even if we take all the beds that are in the private hospitals in Georgetown, let's say it's another 600, right? With 1,200 beds in Georgetown alone, we can't deal with a surge. So again, it comes back to how do we flatten the curve, or how do we prevent this from happening? And the only way we can do that is these simple measures that somehow people still believe that, I think about me, I'm not affected, I'm strong, I'm healthy, I can just walk around the place and nothing can bother me, you know. And we still got to get that message over that anybody can get sick, right? And while in other countries this disease has been really in older people, what we are seeing in Guyana, we have had some, what I would say, fairly young people, right, in the 30s and so forth. Yeah. So people need to understand that they're vulnerable.
We just had a very popular drag racer die. I think he was about 38 years old. Everyone knew him by a call name Mad Dog. Let me ask Richard D, because given the conversation you've heard, given that you're sitting in New York, and we've a lot of us seen the images on TV of people kind of in the hallways asking for help and not being enough capacity. And you said the number of infections is around 70,000 plus. New York is a city of 9 million people, right? Roughly?
8 million.
8 million. And I mean, for us sitting in Guyana, we look at New York as kind of the pinnacle of society. And, we would expect a city like New York to be well on its way to being prepared for this virus. What advice would you give to us as Guyanese? I mean, you talked about testing and stuff, but listening to how our authorities are moving to prepare for this virus, what would you say? I'll add some more context to that. I would hazard a guess. A lot of the West Indian community in New York has been affected because even for me, I have family who are on ventilators in hospitals right now in New York.
It's true, daily. So the lockdown in New York started on March 20th, and we know that we had a lockdown on March 20th because we had lost control of the virus at that point. And we began practicing and enforcing social distancing, and the number of cases have still been rising. And we're hoping that those cases have plateaued, that we're at the peak of them this week and maybe next week, and will begin to go down. We saw in the Guyanese community in New York that taking it seriously took a little bit longer. Unfortunately, we had to have cases come close to home. We had to know somebody who was personally impacted for us to feel like this is going to affect us as well. We're seeing that it's affecting older people, younger people. Just yesterday, we had a gentleman who the ambulance came to pick him up. He's older, and his son, who's 24 years old, begins to show signs that are more serious than the father while the ambulance is there. The ambulance takes the son to the hospital. The son passes away. Again, he's only 24 years old, and then the father passes away at home. The ambulance couldn't take him. And now the whole family is presumed to be positive because they've been living together. So we've completely, our government made a series of mistakes up to this point. At the federal level, we didn't take it seriously. We didn't order supplies. We didn't order, testing at airports. At JFK Airport, which is one of the largest airports on the East Coast, The Guyanese community lives around JFK Airport in Queens. We have, I believe, some of the highest contraction rates. The Guyanese community is also the second largest immigrant group in Queens. So I am, unfortunately confident that the number of Guyanese who will be impacted is going to be significant. And there are still a few people, most people are taking it incredibly seriously now, but a lot of people still are not taking it as seriously as they should. And we're beginning to see that although a lot of New Yorkers are taking it seriously, we're beginning to see that social distancing is actually working by staying away from other humans, including our family members. If we don't live with them, including our mothers, our brothers, if we don't live with them, we have to stay away from them in social distancing. We're beginning to see that that's actually helping New York, and it's reducing, it's flattening the curve, or it's reducing the transmission rate. Our hospitals, we have a lot of hospitals. We have state-of-the-art hospitals. We've built hospitals in public parks in Central Park. We've floated an airport, a Navy ship to take people in. We've stopped all essential surgeries because our hospitals can't take it. We've told people that even if you are positive, you have to stay home. Only if you're dying, you get to go to the hospital. And we're discouraging people from going to the hospital because if you don't have the virus, you might get it while you're at the hospital. We're also short of vital supplies, personal protective equipment, PPE. And so a lot of New Yorkers are making these things at home. We're, sewing gowns and sewing masks and delivering them to hospitals because it's completely out of control.
Wow. And I hope that message gets to the Guyanese. And that goes back to the question I was asking, and put it back to the doctors. What do you think of the curfew or lockdown measures that have been implemented so far? And what do you think we should be doing in terms of social distancing? Are we social distancing enough currently? I know Dr. Anthony started to answer that, but I'd love to explore it a little bit more, because that is the crux of why I wanted to do this show and to get you guys as speakers, because I at least have seen and think that Guyanese are not taking it seriously and not social distancing enough, but that could be me. I'm interested in your views, and I'm sure the viewers would love to hear from you guys.
Let me just say something about this. I don't mind the curfew. The late evening stuff that goes on. I think it's a good move to have some control over nocturnal activities and congregations and bars and sports clubs, etc. What's happening during the day that has me a little bit more concerned. How do we define essential workers? And I'll put it to you an example, my own personal example. Most people would define the doctor as an essential worker. So I have to go to work, but guess what? School is shut, so my kids are home. Somebody's got to be home to look after them. So my babysitter now becomes an essential worker, because if they don't come home to look after my kids, I'm not going to leave them to go to work to look after patients. The minibus driver is an essential worker because he has to bring the babysitter to my home. He has to bring the nurses to the hospital. So it takes a little bit more cerebral activity to come up with these policies than to just, ad hoc create them and publish them and hope to be enforced by a policing service that is somewhat doesn't have the confidence of everyone in the society. You cannot leave the enforcement of this to policemen's discretion. This is, it's not a good recipe for success in this policy. It's well-intentioned, I understand it, but it takes a little bit more thought to get it right.
Dr. Agnew?
Yeah, I heard of another case when the curfew went into place, and that was that nurses at the Georgetown Hospital were in a minibus and they were trying to get home, and the police stopped them, put them out of the bus, probably sent the driver home and told him that he shouldn't be on the road. So, I mean, there are these bizarre kind of things, and we need to make provisions for them. Because the shift system that you have with nurses at the hospital, for example, people would come in for 9 o'clock because their shift start probably about 10, and then they go from 10 to 6 in the morning. So if you have a curfew, you're preventing those nurses from getting to work. So you either have to give them some ID card or something to allow them to get to work without being harassed and challenged and all of that kind of stuff. And maybe if you're going to be doing that as well, you probably need to provide some form of transportation to get these workers from the hospital back home and things like that. So again, I agree completely with Dr. Carpen. We need to really, the authorities need to think these things through, because while they're well-intentioned, they're having adverse effects on the staffing and the quality of care of patients. And these things we really need to make sure that we have them fixed.
The team that is working, I can tell you this about Georgetown Hospital. The team that is working there, from the nurses, the porters, the ambulance drivers, these are all exceptional people who are choosing to be on the job in a crisis. They inspire me every day to turn up to work. And we owe them something to make their work easier, less hassle, less barriers to them being able to perform their job. So, this is something that will take a little bit more thought to get it right. I get it. This is a global problem. We're not, unique that we can solve all the problems. Show me one system in the world that has coped with this perfectly, and I will copy it wholeheartedly. But we're learning as we go along, and what we can do to make it easier for those that provide the care. This is something that we have to look at.
Definitely. And with that, I think it's about time to go to a commercial break. And when we get back from the break, I'd like to actually talk about the task force and a little bit more about the thoughts on leadership, because it relates to exactly what we're talking about. So with that, we'll take a short break here and come back after a few messages.
Hi, it's Richard David. I'm your Democratic District Leader here in South Ozone Park. I'm urging you to take the coronavirus warnings seriously. This idea that it won't happen to me is false. It's happening all throughout the community. We have a lot of people who are in quarantine. Just yesterday, we had double the number of cases in New York City. Please take it seriously. Please avoid human-to-human contact, and we're going to get through this.
You are now able to work from home or from anywhere with a cloud computer. No more worrying if you can't get to the office. Access all of your files and work in an efficient manner with a cloud computer. Best of all, no waiting for a technician to show up to fix all of your computer crashes or viruses or any computer problem. No more worrying about power surge or losing your files. Let Globespan set up a cloud computer for you to work from home or anywhere. Access with a laptop, iPad, or any device that you may have. You can set up your own passwords and keep all your information hidden. Globespan will set up all the antivirus programs, automatic backups, and configure a computer to fit your needs. Globespan has technicians in the US and Guyana to assist you. Call Globespan today. In Georgetown, call 225-9054. In West Coast, call 269-0141. Or in the United States, call 718-551-3290. Did you know the FBI warned against using public Wi-Fi? And hackers using public Wi-Fi can download viruses and steal all of your private information. Let Globespan help you protect against hackers by providing you with a virtual private network or VPN. Keep all of your data hidden and protected, including sensitive information, documents, bank account numbers, and more. The FBI recommends using a VPN, and Globespan can help provide one for you. It's very simple and easy to use. Call Globespan today. In Georgetown, call 225-9054. In West Coast, call 269-0141. Or in the United States, call 718-551-3290. 3290.
Well, thank you for those messages from our sponsors. And building on the conversation from earlier, you know, we've got a lot of brave workers at GPHC and in the front lines of the healthcare system. But I think one of the key things throughout a lot of the responses I've seen across many countries who have responded to this crisis has been leadership. And you've seen a lot of countries, their top leaders come out, talk about the crisis, and then talk about the measures that they were going to take in the crisis. Now, we have seen that Guyana has created a national task force to respond to the crisis. Has anybody on this platform heard from the national task force?
I have not really heard much from the task force. I'm sure they were, doing some work, and they would have had some policies and some objectives that they hope to achieve. But looking at the task force, the composition, I'm not quite sure that there's a lot of technical people on the task force with the requisite training and skill set. Now, I may be wrong that the task force may be receiving expert advice at different levels, and the task force members are just the faces that are presented. But one would feel a little bit comforted if there's a bigger input from recognized technical experts to shape policies and put measures in place, not just to treat disease, but to, allay anxiety and to calm people's nerves during these times. Guyana is going through, a very hectic period, a very tumultuous period in our history, and this is where people look towards leadership that they can have confidence in, and not everybody will get it right, but we need to see the effort, and we need to see the sincerity in what is being shared with the population.
Dr. Anthony?
I think, I think again, we have heard about the national task force, but what we haven't seen is what really they have done over the last couple of weeks. I saw a document that apparently they put out, and it's all wishy-washy measures that they've taken. Nothing that would really make a significant impact on this pandemic that is unfolding, in Guyana. It's a lot of wishy-washy things. The leadership of the task force, the people who comprises the task force, I'm not sure they're the persons you need in that task force at this moment. And in fact, many of the persons who are there, I don't think they have the credibility with the population. And when they're trying to talk to people and maybe get them to understand these things, people are not taking them seriously because, one, they don't have the requisite knowledge, and secondly, I don't think people see them as credible. So they have a big problem at hand. Nevertheless, this is a national crisis, and we really need to bring people with the skills to be able to help us through this problem that we have. Let's look at, this is no big secret. We know that across the world, people, to get doctors, you need to give them the PPE. We have a shortage of PPE in Guyana. I know there have been lots of requests being made to get projections of what is needed in the country. That information has been coming by drips, a little bit now, a little bit later. And therefore, if you're going to get people to assist, like the private sector who want to help, they're not getting that information in a timely manner. So how are they going to assist, right, in helping to get PPE to the doctors that need it? We need equipment. Again, no comprehensive list was done and circulated to people so that people can help. There are lots of people in this country who can help with different things, but they're not being involved by this task force. There's an initiative right now across this country trying to get people to make masks, right? That was not initiated by the task force. That was initiated by the National Stakeholders Forum. And you have literally hundreds of people across this country, ordinary men and women, who are concerned about this epidemic in the country, and they've started making masks and they're distributing it to their neighbors, their friends, and things like that, right? But if you're not involving people, how is it that you're going to mobilize the country to fight this epidemic in the country? You're not, and that's one of the biggest problems that we have. The medical response, I really don't think we're on top of it. A lot of time, my big thing is that we need to find more test kits and start testing people. I cannot accept that in this country, initially we started out with 30 kits. Then we got another donation from PAHO that gave us maybe 100 and 1,100 more kits. That is still not enough. And that is why they're skimping on the kits and only testing those persons who really have all the signs and symptoms of being a COVID-19 patient, right? So we need to get more kits. Why is it if you need more kits, you can't reach out to the private sector and say, you know, maybe we don't have the money, right? Can we mobilize resources to be able to go out there and get those PCR kits and bring them into the country? That is still not happening, right? So we can't, our testing capacity is limited. And there's so many other things that we need to do that we are not doing. When we test somebody, we gotta go and do contact tracing. That is not happening fast enough, right? Look at the conditions of the quarantine areas that we have. Even when you want to take people in, they don't want to go because they feel that the conditions are so abhorrent that they don't want to be there. All of these things, we got to fix them, and we are not fixing them fast enough. Look, one of the things that they've said to us that, you know, in terms of preparing for the surge, that we are going to remodel Ocean View Hotel and make it a place now for isolation. That we're going to take the Cliff Anderson Sports Hall and make it a place for isolation. We're going to take the gymnasium and do the same thing. Okay, great. But what has been done so far? We know the conditions of the Ocean View Hotel. About 2 years ago, the Auditor General did a report where they were talking about infestation in the building. Have they gotten rid of the infestation? Are you going to now put people over there without cleaning up that place properly and making it fit to become a unit that you can manage patients in? And maybe all of this is happening. Maybe it's happening. What is certainly not happening is communication with the people of this country so that people know what is going on at Ocean View, what their plans are. And that's where you need credible people going out every day and explaining, this is the problem that we have, this is how we are solving it. What we are hearing is that we got a couple of cases today and we don't know what we are doing. That's what people are hearing. And in a crisis like this, you cannot have persons just going out there and looking like if they're so hopeless, right, that they don't have a solution to this problem. They are going to make people panic in this country because of their behavior.
But to be fair to them, I mean, Richard Rambaran, talk a little bit about the interactions the chamber has had with the National Task Force, particularly the Civil Defense Commission, who, for the audience, is our version of the US's FEMA, in essence.
Thank you for that, Nick. So we speak with the Civil Defense Commission from the Chamber of Commerce's perspective, at least once weekly. Um, our discussions with them and our interactions are along the line of equipment and PPEs and materials that they will need. And it seems as if the Ministry of Public Health has an understanding of what ratios exist as regards serious cases to equipment. So the Chamber of Commerce is engaged with the Civil Defense Commission. Um, Only recently we have opened up our membership through the secretariat. We have been discussing with our membership on the basis of donations and trying to get together a number of care packages, a number of donations as regards PPEs, etc., so that we can, from the private sector's perspective, begin to assist in this. So I wouldn't want to say that the communication has not been there um, with the private sector. At least from the Chamber of Commerce, we are engaged with the Civil Defense Commission. We do speak with them consistently. Um, Colonel Craig, who heads that Civil Defense Commission, also is very reachable. We can reach him at any time, himself, Nick, and others from the Chamber of Commerce. But I do agree that on the point of public policy, a major part of it is the art of communicating with the populace and sending credible signals that one has this under control, or at least we're headed in a particular direction. So yeah, we have now begun to speak with the CDC, and it seems as if that commission is very forthcoming as regards how we interact with them. I would like to ask a question, however, to the doctors here. The global death rate for persons infected with the virus is roughly around 4 to 4.5% if you take those countries which have cases more than 100. In Guyana, if you will take a look at just what we have currently, it's never gone below 10%. Roughly, we are at about 15% right now. The question I'd like to ask is, we therefore are about 3 times what the global death rate is. Is it that the Guyanese population is more susceptible as regards perhaps passing away from this virus, or do you think that we are about 30% in terms of what we have tested and where we actually are? I'd just like to know the medical doctor's
Yeah,
perspective on that.
I
I
think
think
that's a great question.
you answer your own question there. The denominator is unknown, and that is why
Exactly.
the percentage is so
Yeah.
high. If you get the denominator right, that's when you will see the actual number. So, 5 out of 30 of those who are tested is quite different from 5 out of 300. So
Yeah.
if you get the testing, that's when you will know. Which is why I'm coming back to what I had said earlier about the paradigm in which we need to look at this. Not just the number of positive cases. I believe we're going to be shifting away from that because we cannot test everyone. And we have to actually look at the number of hospitalized cases or the number of patients presenting with severe enough symptoms. Who presents to hospital like that, who needs ICU level care, who is intubated, and then who die and who can recover and who can go home. Those are the metrics that will really be used to gauge severity of the disease. While I have the microphone, so to speak, I would like to ask our future congressman a question about the spread of disease in the state of New York. Are you seeing more cluster in the city versus places outside of the city, like where the less populated or where the less densely populated areas are? Because that has direct implications for the disease spread in Guyana. As you know, we have population cluster in Georgetown, but as you get to Maikoni and Abari and those places, the population is a little bit more spaced out.
Yeah, we have clusters in New York City, and we are seeing the highest concentration here and not so much outside of the, even in Long Island doesn't have the number of cases here. Long Island is more of a suburban area. If you go upstate, the numbers pale in comparison. Nowhere in the country has seen what we're seeing here. And what we've seen across the country is that it's typically concentrated in large towns and major cities. What I'll also say is, in terms of who is more likely to be a victim, pass away from this virus, what we're seeing in New York is that men are more likely to pass away than women. What we're seeing is that men of color, and when we say in New York men of color, we mean Black, Indian, non-white men pass away at a higher rate than others. And the reason that we believe that that's the case is because of the higher concentration of pre-existing conditions in these communities that make it more susceptible for this virus to lead to a fatality. What we also know is that men, and typically men of color, Guyanese men, live shorter lives, in some cases 10, 15 years than Guyanese women. We're seeing a lot of that play out with this statistic as well, here in New York and here in Queens.
Let me ask a follow-up on that to the doctors in Guyana. What is the prevalence of NCDs or non-communicable diseases in Guyana? Because obviously, as you all said earlier, this is going to be an underlying factor in the rate of deaths as a percentage of the infected cases or infected persons.
You want to start?
Go ahead.
Oh, yeah. So again, it varies across groups and subgroups of, like, for example, the South Asian descendants, the chronic non-communicable diseases of diabetes and heart conditions is different from, let's say, for our native Amerindians or Chinese European descendants. It varies across group, but overall, on a population basis, I think it will probably be between a 10 to 20%. And bear in mind that all our deaths, 1/3 occur because of cardiovascular disease. And so this is where you get into an area that I actually enjoy, with understanding how disease actually affects human body. What we are learning now, recently, we used to think of this coronavirus as something that damages your lung, and that's it, that's how you die. But we're shifting that paradigm now. A lot of things are becoming revealed on a daily basis. So what we know is that the virus attacks your red blood cell, which is what is responsible for carrying oxygen to the rest of your body. It does so by destroying or releasing the iron that is stored in the core of the red blood cell. When it releases that iron, the iron is toxic to the body, and it's mass release. And so therefore it overcomes all your defense system in the lungs, in the heart, in the kidney, in the liver. So more and more, you're starting to see people not just with shortness of breath, but they're coming in with heart failure, liver failure, kidney failure. And it's a state of perpetual low oxygen, or what we call hypoxia. So imagine for a minute, a Guyanese male living in Queens or living in Georgetown, who already has a risk factor for having blockage in the heart or chronic ischemic heart disease. And here you have an infection that also reduces the oxygen in the body. So you have two ways in which the heart muscle are being starved of oxygen. So guess what happens? Those people then end up having more heart attacks, more ischemic heart disease, and a shorter span. The severity of that effect is felt, and hence the mortality rate and the hospitalization and everything else will go up in that group.
Now, let me ask a follow-on question.
Dr. Carpin, just one follow-up to that. Wouldn't that proclivity for a higher prevalence of NCDs in Guyana actually cause perhaps a higher than usual death rate here in the country?
It would stand to reason if they're unless there are other variables that we're not yet factoring in. But if it's a straight correlation between chronic non-communicable disease and coronavirus, if that's the only metric on the table, I would say yes. But there might be some other variables, like the one we mentioned, like population density and distribution. That may be something that can affect, the disease curve.
Now, from the audience, we had a question that I think would be important to pose to you guys is that do we have a treatment protocol? Now, we've seen in the worldwide a number of different things talked about. We've seen hydroxychloroquine and chloroquine talked about. We've seen Cuba has talked about a drug called interferon. What is it that Guyana is going to use to treat its patient when they come in infected?
All right. So this disease has been around a very short time. So the usual robust body of evidence that we need to make universal guidelines for any drug treatment does not exist. If anyone in the world says they know exactly how to treat this, they're probably not telling you the whole story. So we're approaching this as if it's a wartime scenario. We use the evidence we have until we get the evidence that we want. So, as you mentioned, hydroxychloroquine and chloroquine azithromycin. These drugs have been used to treat malaria for decades. In Africa, it's been there for 50 years, the same thing in Guyana. Not surprisingly, if you look at what's happening in Africa, there's a very, very low prevalence of coronavirus disease or COVID-19. Is it because that they have so much use of the chloroquine, or they have access to it, or some systemic change that they would have undergone? So that kind of formed the basis of a lot of anecdotal treatment plans. And now many, many countries have incorporated hydroxychloroquine or chloroquine and azithromycin as treatment for the disease, and also as prophylaxis or prevention. The question of interferon, if you have access to it, it's best used in the early phase of the infection. And of course, it has to be used as a nebulizer, like how you use your asthma medication. So that's how it's used, and there have been quite encouraging results. But coming back to the concerns expressed with hydroxychloroquine and chloroquine, these are prescription drugs. It's not for everybody. Every drug has side effects. And they have to be used with caution, for everyone's protection, to know that, look, we don't have the usual double-blind, randomized, multi-center controlled trials as evidence. But what we have is, quote-unquote, wartime evidence for its use. And if it's the best that we have in Guyana, because we don't have the antiretrovirals and the interferon and those other things yet. And if we can initiate a treatment that prevents us from getting to the intubated ventilator stage, then perhaps we ought to give it a shot.
Got it. Well, on that note, we're going to take a quick commercial break. And then as soon as we get back, I want to talk a little bit more about leadership and then the economics of the crisis. So with that, let's take a few seconds to recognize those who are helping to sponsor the program.
Attention fellow Guyanese, no need to go into person anymore to book your flight. Book your flight over the phone with a Travelspan GT agent. Once you finish booking over the phone, our agent will give you a payment center close to your home. That's right, no hassle for travel anymore. Travelspan is making it convenient and easier for you to book your flights. No need to travel to the office. Call Travelspan GT today for low fares. Call 227-1701. That's 227-1701. Or in Berbice, call Rose Hall at 337-4287. Travelspan making it easier. So call 227-1701. That's 227-1701. Or Rose Hall at 337-4287.
Right. That's I think the virus has had a heck of a impact on the travel industry. It's a tough industry right now. Now let's go along the line. So first for Richard D, let me ask. A lot of us here have been following the press conferences with your governor, Governor Cuomo. You know, how has his leadership been? Um, Post, I guess, let's say there has been obviously a turning point where they moved from being a little bit more lagging in response to being very firm in response. So now that he's a little bit more firm in response, how do you feel, about that type of leadership with him being out there, defining what they're going to do, speaking directly to New Yorkers in terms of how they're going to get them out of this crisis?
At 11 o'clock every day, a lot of New Yorkers turn on the TV if they're not already watching,
And
and
Guyanese, right?
including Guyanese. And it's
Absolutely.
Coffee with Cuomo. We're watching the governor because, not a lot of people are, not a lot of people pay attention to politics in New York. But this crisis has symbolized the need for leadership, the need for somebody to understand even medical information, and you don't have to be a doctor because this crisis needs you to be, informed about so many different things. I think that the governor, people will criticize the governor for not taking precautions earlier, not taking this seriously, and not shutting down the state even earlier. At this point, though, we all have perfect vision looking back. At this point, a lot of people are happy with the governor. A lot of people feel like he's doing what we need, and we feel like there is potentially light at the end of the tunnel. There's a lot of uncertainty about when we get out of this tunnel. We don't know. But the governor gives us an update every day at 11 o'clock, and he seems to have the information, a real command of the information. So it's inspiring confidence.
And you're saying, so comparing what Dr. Anthony had talked about earlier, what we get around, and it shifts sometimes from 12, 3 p.m., we get the statistics. We get the number of cases that are, number of persons infected, number of persons quarantined, the number of deaths. What information does Governor Cuomo put out there? Is it just the statistics? Does he say anything else? I mean, I know a lot of us watch it, but for the percentage of the audience here that watch it, what does good leadership in this crisis look like?
I'll say this: we're getting pretty solid data, and we understand the data, and a lot of us understand that data isn't fully accurate. It's crisis information, and we believe that those numbers are not just entirely accurate. But what a lot of people appreciate about the governor is that he will. We've come to expect that he'll tell us like it is. He'll tell us we don't have enough PPE. He'll tell us we've run out of ventilators. He'll tell us the federal government hasn't done something. And he'll tell us New Yorkers aren't following the rules and so of social distancing. So I'm going to double the fine to $1,000, which is what he did. We believe that he's telling us the truth. We believe that he's telling us the hard facts, whether we like it or not. I think that a lot of people appreciate that, even if it makes people a little scared. And he's covering all kinds of information, not just data and statistics. He's telling us about rising cases of domestic violence and child abuse when people are confined to their homes. He's telling us about how we can get exercise. He's telling us about his family life and what he does with his daughters. And so a lot of that is helping the Yorkers who are in our house 24 hours now cope with this situation that we've just never, lived through.
Well, that's incredible, and I hope that we inculcate that and quickly, because in all honesty, I think we're going to have the type of crisis that New York has for our small population. Now, one question still on the medical side before we shift a few questions in terms of the economics. Someone wrote in and asked me to ask about something that I've also seen on the news, which was the use of plasma, meaning the use of plasma from persons who have recovered from the virus, which has obviously antibodies to the virus. Uh, would any of the doctors like to speak to that? I know it's really, really new, and it's a question of how is it working, and whether that could be some sort of let's say a stopgap measure until a vaccine.
Yeah, well, again, that has gotten some traction in some places, but it hasn't received enough evidence yet to make it standard. People are working on all kinds of stuff. The transfusion of plasma or antibodies from recovered patients. They're trying to isolate specific immunoglobulins that can be then infused into other patients, etc. These are all in very, very early stages, and we don't have enough evidence to say that this thing works or it doesn't work. But I'll come back to, if you're going to transfuse anything, you're probably going to be better off transfusing whole blood. Because what happens, as I had mentioned before, the virus destroys the ability of your blood cells to carry oxygen effectively. So what you need is to replenish that oxygen carrying capacity, and you can only do that by producing new red blood cells. So if the patient is not making new red blood cells, you need to supplement that and giving them new red blood cells from a donor. But, I mean, again, these are all concepts. They're based on some science. We're in a war, and we have to adjust and adapt and use common sense. This is when most of the useful innovations in technology happen.
Now, Richard Rambaran, I know that we've had a lot of internal discussions, but let's share some of those discussions externally now, because I've been given the time warning that we have a few minutes left, but I wanted to flip the switch and talk about the economy. And I use flip the switch out of joke and fun because apparently Georgetown is or is not a bulb. But you and I have talked a lot about what the virus itself and the infected persons, as well as the stay-at-home orders will do to the economy. What message would you say, in this type of forum? What can we expect to happen in our economy?
So thank you, Nick. And I think we have focused a bit of the discussion on the public health impact of it. But the part for me that is especially worrying is the economic impact of what will happen. So there are two components of what's going to happen here: the public health impact and the economic impact. And that in particular is where we as economists and persons in public policy, etc., need to begin to divert some of our attention. Those, of course, who are not on the front line and battling. I don't want to miss this point because I believe that it's of utmost importance within the public policy arena. The point that was made by my namesake earlier about that reassuring role that governance has, and public officials with the confidence of the population, sending credible signals to the society that this will be okay, that this is reassuring. It's not just good for persons to understand and to have a leader to look to, but also for the mental health of many. Some persons are home for weeks at a time currently, and people really have not been able to. So I want to say that the art of public policy has to encapsulate that element of good communication, and it has to be in a way where it's not condescending or somebody talking to children or so. It has to be in a way. I mean, if one looks at Mia Mottley, for example, Prime Minister in of Barbados, you can see that humanistic element and that human touch coming out. But I just want to say also the point coming a bit more focused on the economic aspect is that the point that Dr. Carpin raised earlier from a layman's perspective, gives us a very good platform upon which to premise the discussion, or the remainder of the discussion, is that there is a tremendous interdependence that exists in the economy. Firms produce, consumers consume, consumers provide their labor to firms, and firms give them goods and services. Persons utilize transport to go around, and they all depend on each other. It's a mutually reinforcing relation, and it's one that is very much interdependent. Now, if you look at the nature of this crisis, a lot of persons are attempting to compare it to the 2008 crisis, and maybe even in the 1918 influenza epidemic that besieged England and other parts of the world. But I would reckon to say that this crisis is a little bit unique, because in 1918 you had some war production which offset some of that negative impact on the economy. In 2008, the difference with that crisis and this one is that the recommendation to keep this virus in check is one of social distancing, which means that persons should not be going outside. Now, that is a very interesting perspective from a public policy and from an economic impact perspective, because what it does, it limits an individual's ability to physically go out and spend. And they are not in economies like ours that are not very complex or advanced or modernized in the way that consumers consume goods. What you'll find is that a person's commodity basket or a person's spending power will really be geared only towards the essential items. Why is that so? One, because they can't physically go out, but two, because of the amount or the quantum of uncertainty that's prevailing in the economy at this point in time, and the amount of uncertainty that people have generally. So it's very much needed for reassurance to be given. Now, I want to just separate the economic impact into two parts very quickly. One, we have to look at directly right now what we are going to do. And I think that at this point, and I see that colleagues around the world in the profession share a similar view. Right now, we need to just have spend, spend, spend on this crisis. We need to be able to limit the public health impact on this crisis, because in the medium to long term, that will have a debilitating impact on our economy if we allow this to continue unmitigated.
Now, Richard, let me ask
Yeah.
you a question. How is a government that has not doesn't have a parliament behind it, because it's pretty much in a caretaker mode, and last budget in November 2018 going to
Yeah.
spend in this crisis?
Thank you. Thank you for that, Nick. So that's a very relevant question within the context of Guyana. Now, it's a very worrying situation, because there are two types of interventions that the government can make. Central bank can intervene through what we call monetary policy, changing interest rates, etc. But the most important and the most potent for a country is what we call a fiscal stimulus. Now, in a situation like this, you would have had ordinarily a finance minister approaching the budget, approaching the parliament with a supplementary budget, in particular a fiscal stimulus package to a certain extent, and having that approved by parliament. So the absence of parliament is impacting on that ability for a finance minister to approach Section 23, I believe, of the Fiscal Management and Accountability Act, for those who are interested, outlines clearly what those measures are. But we currently don't have a parliament in place. Our elections continue to be dragged on, and the outcome is unknown. And this is actually going to have a serious and a material impact on how we recover from this virus, and not even how we recover, but how we are able to right now mitigate the impact in the economy. Because what you will find is that around the world, one thing economists are agreeing on is that at this point, governments should intervene to offset some of that impact that is had from this crisis. So they're calling for things like helicopter money, which is essentially giving persons money into their hands to ensure that they survive. How we are going to do something like that in Guyana this time, I am not sure. I do believe, though, that we do have some creative measures that we can undertake. So, for example, I am not sure if the government has explored this, but one can ask for a reprogramming of monies, donor monies that have already been disbursed to the country, and reprogramming it towards expenditure for this public health crisis, given the nature of it. And there are other very many creative ways. But in this scenario and in this situation, we really do find ourselves with our backs up against the wall. And this political scenario which we have is really not helping the economic situation. So right now, I think for Guyana's quagmire that we face, the fastest way out of this is to ensure that that is solved so that we have the ability to enact a fiscal stimulus package and even protect the welfare of the average Guyanese citizen. Because that, in effect, will in turn create social instability.
So you're saying essentially, with basically the election being dragged on, we are fighting this crisis with one hand behind our back.
I would say one of our hands are chopped off and the other one in our pocket. That would be the way that I would put it. Because our ability to bring forth fiscal stimulus packages is almost nil. And if you look at how our responsiveness has been thus far, you will find that it is very wanting in that regard. Because the Guyana Revenue Authority can only do so much. You'll only find them changing payment dates. You'll only find them waiving what they can waive, etc. But the real power comes from the Appropriation Act, which has to be passed by Parliament. And the real powers to impact the situation in a material way will come through in Guyana's public financial framework, will come from the finance ministry, one which is fully installed and enjoys the powers, etc., fully accorded on to the person after.
Thanks for that. Unfortunately, this brings us almost to the end, and I would like to get some closing statements. So let me start with Richard D. Lead us off with any messages you'd like to leave for the viewership and for the people of Guyana. Given that we are about to go through the same crisis that you are facing there.
I think Guyana's at a really key moment where you have the ability to control community spread, both in Georgetown and outside into the villages. It's the only opportunity to really save lives and to save money and to really protect the health infrastructure that's in the country. If you don't get this moment right, the crisis will get to a place like we have here in New York. Millions of New Yorkers are going to sleep tonight, having been in our homes 4 weeks now, unable to come out unless we have an emergency. Millions of New Yorkers are going to sleep tonight with a loved one that they've lost or someone they know in a hospital. We appreciate all the prayers that we can get anywhere in the world, and we are so it means a lot that the Guyanese community in Guyana is thinking about us here in New York in our moment of crisis.
Our hearts definitely go out to you. And to Dr. Anthony, anything you want to leave with the viewers before we wrap up?
Sure. Again, I think, to respond to the public health crisis at hand, the first thing that we have to do is to find ways and means of how we'll suppress the virus. And we can only do that if we maintain what we've been talking about all along, and that is the social distancing. We need people to take it very seriously, because if they don't, we'll have the impact and the consequences that we are seeing in other parts of the world, where some of these places, unfortunately, have become the epicenter of the epidemic. We can change that dynamic here, but again, we need to do a number of things, which would include what people can do. The population can do the social distancing, the hand washing, and so forth. That's what the population can do. But also we need government to take policy measures, which they have so far not been able to do. And we need our health system to be properly resourced so that they can give us the service that we require. Right now, the health service is improperly resourced because they can't get a lot of the basic things that they require. Now, part of that might be because of the financial crisis that the government has found itself in. And the faster we resolve the political issues, we'll be able to get more financing flowing so that we can deal with the public health crisis. But one of the things that we need to also understand is that when we try to flatten the public health curve as it is, we are also flattening the economy. And we have seen that around the world. And so one of the things that we need to do is we need a set of package like Richard was talking about, how we'll stimulate the economy. What are we going to do for businesses? One of the biggest impacts that has happened to people right now, some people are locked away, and maybe not fully, but we are seeing businesses are closing and sending home employees. We don't have a safety net for those employees. I saw just a day ago that Gaisuku is closing the Borbisa estates. Now, if they close the estates and people are not going to get money, then how you expect them to live? So in other countries, you've had packages where people are given some amount of money so that they can stay at home and enforce the lockdown as it is. But if you don't help those people and they're already vulnerable, how do we expect them to live? We have a lot of, look, there's so many backward things that we are seeing. Pensioners had to go out a couple of days ago to get their pension, and they had to stand in line, not observing any social distancing. And a lot of them can be infected if you stand in line like this. So these things, we have to change our policies to respond to the crisis that we have at hand. And agencies of the government need to respond accordingly. They can't be, just playing catch up. They have to be the ones who are leading this. And unfortunately, we are not seeing that. So if we are going to really change the dynamics of the epidemic in Guyana, then there are lots of things that we need to do. And we need the agencies of government to play their role and to play it in union with what else is happening. And right now, we really don't have anybody conducting that orchestra. And if we don't, we are going to have lots of missteps, and we are going to make tons of mistakes, as is happening right now.
Dr. Carpet?
Thanks. Well, I must thank you for inviting me to be a part of this panel in the first place. And I want to focus my closing remarks basically on my colleagues and healthcare workers. And I want to reassure them that their efforts are noted, and they inspire me by turning up to work every day and by walking into that hospital wherever they work, putting on whatever little protective equipment is available to them and going on the front line. They are our soldiers, they are front line, and they're our last line of defense. And I want to acknowledge their contributions. I want to say thanks to them. I want to give them all the moral support and everything that we can at this point. While the rest of the world is running away from the disaster, these are the people running towards it because they can make a difference. These are our real heroes. And when this is over and when this is beaten, and make no mistake about it, we will beat this because this is going to be our finest hour. We should make whatever provisions necessary to ensure that these people feel the appreciation, the love, and all our gratitude.
Thanks. And that's a very poignant message both for the healthcare workers in New York as well as those in Guyana, and we definitely appreciate them. Richard Rembrandt, closing thoughts?
like Dr. Carpin, I want to thank all of those who consistently go out every day and brave the storm, if you will. Of course, they are the real heroes in all of this. Those persons who put their lives out there um, on the front line. I want to also say that the acute nature of both the public health and the economic crisis, I would say at this point, that has besieged the country, has exposed quite a number of systemic flaws which we have here in Guyana. I don't want to get into all of them, but of course, the careful observer is able to see what is happening. It is my sincere hope that after this entire election process is concluded, etc., that whoever takes the reins of government really understands that the future of Guyana and how prepared we are for crisis and disasters, it does lie in their hands, and the responsibility is at their feet to ensure that a situation like this, as regards our poor level of responsiveness and our unpreparedness, never occurs again in the future of Guyana. I really do want to take this time also to encourage everyone who is looking at this program, who may look at it, to practice social distancing, keep attuned to the reputable sources which can provide you with information. And we will get through this. We certainly will get through this, but it is just a matter of us following the guidelines and doing what we have to do in accordance with the suggestions and the guidance of the medical professionals and the health professionals. So I just want to urge everyone to stay safe. To the colleague in New York also, please do keep yourself safe.
Well, thank you for that. I would like to thank Mr. Noor Singh of Globespan for allowing us this platform to get these messages out, because it's something that personally I feel that more Guyanese need to become aware, need to learn more and quickly about this virus as it hits us. I would like to encourage persons, if you want to check us out on Facebook, the Georgetown Chamber of Commerce and Industry. We're on the web at gcci.gy. There are a number of initiatives that we're doing to help support those, both the medical workers through donations, for instance, of personal protective equipment, as well as food for those who are in underserved communities or who have been laid off recently. With that, I've been your host, Nicholas Boyer, President of the Georgetown Chamber. Thank you all, and I hope you have a great evening. Take care.
Thank you. Thank you. Good night.